Hello class, today I'll be talking about respiratory distress syndrome. Respiratory distress syndrome, also known as RDS, is a breathing disorder that affects premature babies. RDS is a rare illness that happens less than 200,000 a year. RDS is common if the baby is born 6 weeks earlier than the due date. Nearly all infants born before 28 weeks develop RDS. RDS can be an early phase of bronchopulmonary dysplasia (BPD), another breathing disorder that affects premature infants. If the premature baby still has a breathing problem after his actual due date, then he gets diagnosed with BPD. Some of the RDS treatment may cause BPD. RDS is common amongst premature babies because their lungs are not fully developed. If the lungs are not fully developed, then they're lacking this slippery substance called surfactant in their lungs. Without enough surfactant, the lungs collapse and the infant has to work hard to breathe. He might not be able to breathe in enough oxygen to send out oxygen to his organs. If there isn't enough oxygen, it can damage the baby's brain and other organs if proper treatment isn't given. This is the picture that shows what happens if there isn't enough surfactant in baby's lungs. The alveoli will shrink just like how it shows in the picture on the right. In the left picture is a normal alveoli. If the alveoli shrinks, then the baby will have a hard time to breathe. These are the pictures that show the difference between the normal baby's lung and RDS affected baby's lung. As you can see, the left X-ray shows the white cloudy lungs that is affected with RDS, and the right X-ray picture shows normal baby's lung. There are some other factors that cause RDS. If the baby has a sibling who had RDS, the baby can get it because it can be genetic. If the baby is born through C-section or induction before the baby is full term, the baby is born premature. Therefore, he can be affected with RDS. If the mother carries 2 or more babies, the babies are more likely to born premature, which can cause RDS also. These are some of the symptoms that show if the baby has RDS. Lack of oxygen in baby's body can make the baby's skin to turn blue because the blood can't transfer oxygen throughout the body. It is important to see if the baby stops breathing for a short time or breathes rapidly. The baby may make sound when he breathes. Because he is having a hard time breathing, he can also show unusual breathing movement. These are the exams that doctors run to test if the baby has RDS or not. One of them is called blood gas analysis. This shows low oxygen and excess acid in the body fluid. Another method is chest X-ray. This shows a ground glass appearance to the lungs that is typically of the disease. This often develops 6 to 12 hours after birth. Ground glass is when the X-ray picture of the body shows up cloudy. Lastly, there is lab test. This helps to rule out infection as a cause of breathing problem. Treatments. Warm, moist oxygen will be given to the babies, but this treatment has to be carefully monitored because babies can have too much oxygen in their body. Also, giving extra surfactant shown to be helpful to sick babies, but there is some risk involved since the surfactant is delivered directly into the baby's airway. Another treatment is ventilator. Assisted ventilation with a ventilator can be life-saving for babies, but use of a breathing machine can damage the lung tissue, so this treatment should be avoided if possible. Lastly, there is a treatment called continuous positive airway pressure. CPAP. This may prevent the need of assisted ventilation or surfactant in many babies. CPAP sends air into the nose to help keep the airways open. It can be given by a ventilator or with a separate CPAP device. This was my presentation, and thank you for listening.